There's a lot of confusion tonight when it comes to funding for one of the largest research study programs, and this is specifically on women's health.
Yeah, the U.S. Department of Health and Human Services reversed course and will restore funding after it was announced just last week it would terminate Women's Health Initiative regional center contracts at the end of September. Well, one local WHI principal investigator shares how vital this research is and the impact it has had over the decades to women's health. It's all new at 11. Outrage last week from medical experts after the Women's Health Initiative announced its funding would be cut.
It's heartbreaking and really would be a devastating loss to women's health.
Now, the U.S. Department of Health and Human Services says funding will be fully restored, stating NIH remains deeply committed to advancing public health through rigorous gold standard research, and we are taking immediate steps to ensure the continuity of these studies. Women's Health Initiative conducts research focused on answering many of the most pressing questions about women's health. More than 160,000 postmenopausal women enrolled nationwide, participating in studies to help identify the risk factors for chronic disease, improve aging, and extend the health span.
We also have hundreds of thousands of blood collections, biospecimens in a repository. We want to be able, again, to leverage these resources to learn as much as we can.
Brigham and Women's Hospital Division of Preventative Medicine Chief Dr. Joanne Manson is a PI of WHI. She says much of the research is focused on cardiovascular disease, cancers, preventing fractures, cognitive decline, and mobility loss. The findings have influenced clinical guidelines and improved public health. According to WHI, it has prevented about 126,000 breast cancer cases and 76,000 fewer cardiovascular disease cases over the decade.
There are estimates that one of the clinical trials actually saved $36 billion in medical costs by improving the clinical decision-making related to hormone therapy.
And Dr. Manson notes the WHI has a major role in training and mentoring the next generation of researchers in women's health and prevention. And as of Friday, the WHI says it has not received confirmation from the NIH that funding would be restored.